what are generally the outcomes that you're looking for with PRP and stem cell?
Well, let's go to a couple of statistical slides, and hopefully these will transmit well enough. So this is a company called DataBiologics, a really value-added company through the pain management and orthopedic world, has been tabulating across a number of clinics in North America for several years. And this chart will compare all of the clinics that are in the DataBiologics world to ours. So if you look at the black line out through 12 months, which is approximately 14,000 patients, believe it or not, and it's growing weekly, versus the purple line below it is the Austin OrthoBiologics, which is about approximately 300 patients. And we picked up on this about 18 months ago. So our endpoint is a little bit shorter. It's at 12 months. But this is a numeric pain rating, 1 to 10. Most patients started somewhere in the 5 to 6 range, which you'll see there. And we feel that the DataBiologics numbers from a large series is quite good. The pain is down below 3 at 12 months, and we anticipate that will, because this is a combination of both PRP and the stem cell, will continue through 18 months. But look at the purple line. Lower is better. The less pain you have, the lower the line will be. So starting at about 3 and continuing through 6 to 12 months, we actually feel like our patients all across the board. And when you look over to the right, you'll see that the majority are knees, but there's a lot of hips and shoulders as well. Those patients have less pain than even the baseline pain relief that the clinics around the country are seeing. So we feel this really merits consideration. This is a procedure that works for the vast majority of people in terms of relieving their pain.
Yeah. Okay, great. Now let's look specifically at the shoulder results that you've seen so that we can kind of talk about the shoulder effectiveness.
So this is more of an activity rating. This is called the Quick Dash method, and Quick Dash is just an algorithm. Lower is better. The less restriction you have in terms of return to activity at 6, 9, and 12 months, even out to 24 months for the larger series, which again is, in this case for shoulders, is close to 3,000 patients. The black line is mirrored quite closely by our purple line, which is approximately 75 patients. We've done many more than that, but these are the ones that have responded to the patient-reported outcomes, PRO, questionnaires that we send out on a several-month basis. Average age 58, average injections a little over 1. So most of these patients don't even need a second injection within 12 to 18 months. We would anticipate that we will mirror the curve of the black line as we follow our patients further out. But once again, this is a little bit closer, but we feel like we're actually exceeding the improvement of the large group. So we're quite happy with the treatment using both PRP and stem cell of the shoulder.
Sure. And then when it comes to the knees, you're seeing good results as well.
So one more chart to see there. Now this you have to flip in your mind. This is called the KOOS knee measurement. Once again, it's an activity level measure, but here it's just a different algorithm. So higher is better. So what we're seeing is somewhat interesting. There's an immediate improvement in both the 7,000 North America-wide patient group from DataBiologics, and then about 120 of our own patients shown in the purple line. Look at the flattening out after 1 to 2 months, and then pretty dramatic improvement again between 6 and 12 months. With continuation, we would anticipate all the way through 18 to 24 months. And that means that people kind of settle back into their activity level and then kind of take off. We also think this supports doing physical therapy a few months into the treatment so that you get your muscle strength and balance and your kind of kinesiologic or muscle memory back. Because we see this late improvement. So once again, I feel like our results for the knee or perhaps even a little better. Same age difference, 50, or same age, average age group, about 58.
Okay. Seems to be kind of the average, when some of us start having problems. So
That's about right. I see
yeah,
people all the way up to their 80s who
yeah.
are still snow skiing and playing pickleball. But yeah, probably late 50s, early 60s is our average group.
Mm-hmm.
So kind of summing those results up, and again, this is a data biologic slide. So this is across the board, across North American experience. 73% of patients feel like they had an improvement in function at a period of 6 months. That's a pretty strong number. And if you break it down into three categories, the platelet plasma, the cellular stem cell therapy versus non-biologics, which would primarily be steroid or what's called hyaluronic acid or a lubricant, or the old folks call it rooster comb. The baseline lubricant and steroid, about a third of patients improve. But we've almost doubled that with stem cell, and even PRP is pretty close. And I think the stem cell number is important. Half of these people improve, but generally there is what we call some selection bias. That
Mm-hmm.
means that typically the stem cell is going to be used for the people that have a bit more progression of symptoms and arthritis. So to see a 50% improvement
Mm-hmm.
at just a few months is quite significant, we think.